Dr. Manjiri Somashekhar, lead pediatric surgeon at Aster Hospitals, Bangalore. 29th of December is observed as National Pediatric Surgery Day in our country. This year the theme is dealing with urinary tract complications or problems in children. So what does this include? This includes problems or swellings in the kidney, the urinary tract infections, external genital problems like abnormal shape, size, or any infections happening in them, undescended testis, swelling in the groin, testicular swelling, any emergency problems happening in urinary tract of the child. So these problems should be identified at correct time and addressed and taken help from a pediatric surgeon. One of the important observations in young boys is not able to find the testis in its correct position. So when the baby is born, if the baby is born by 9 months complete gestation, then we should observe both the testicles in the groin at the time of birth. If in case it is not there in the proper place, it should be either be palpable anywhere in the groin. In preterm babies, the chance of it descending in 2 or 3 months is high. Like 50% of them might descend, but other 50% may not descend. So after the age of 3 months, if it is not descended, then do not wait for a longer time. It needs a surgical fixation. We mobilize the testis and fix it in a proper position. So what if it's not fixed in proper position? There are multiple problems can happen. If the testis is not descended, it can undergo trauma, it can undergo torsion because the support is not there, it can undergo infection, or it can undergo atrophy. Atrophy means it will reduce in size and there will be functional loss. So these are the dangers of not fixing the testis in its place. What if you don't find in the groin, you don't find in the scrotum, you don't find the testis at all physically? Then testis will be inside the tummy. That is where it develops and it should come out by the time the baby is born. So you undergo a scanning process. The scan most of the times can pick up the testis if it's there inside the tummy, if it's of significant size. But if it is very small, it's still difficult. So correct age of 6 to 7 months, you approach a pediatric surgeon and find out where is the testis lying. We can do a diagnostic laparoscopy, do a search, find where is the testis, where are the vessels going to testis, where is the vas coming from, and if it is found inside the tummy, we mobilize and bring it out into proper position either in a single stage or 2-stage operation. So that is called orchidopexy. In case both the testes are not found, then you have to worry about the hormonal levels of the child. Whether there is any abnormality in the hormones, testicular hormones, or if the female organs are also present inside. That is what we call it as disorders of sexual differentiation. If you observe any of the symptoms in your child, please do contact the nearest pediatric surgeon in your vicinity for further management. Pediatric Surgery Day is observed once in a year on a particular day, that is 29th of December, by the Indian Association of Pediatric Surgeons to spread a word and awareness about availability and treatability of certain problems in the children by a pediatric surgery community. Thank you.